February is Heart Month, and sudden cardiac arrest is the leading cause of death in young athletes. While experts say that these emergencies are rare, it's important to get a thorough exam before playing sports.
Dr. Jon Detterich is joining us here from Children's Hospital Los Angeles. Thanks so much for joining us.
Oh, thank you for having me.
So we've seen, very highly publicized cases. We had Damar Hamlin, Bronny James, who had these sudden cardiac events. Can you explain what they are?
No, it's a great question. So sudden cardiac events during exercise can be from a number of different things. The most common is an inheritable genetic defect of the heart muscle itself, causing a structural problem. But it can also cause rhythm problems, so there can be inheritable genetic defects that cause rhythm problems. In Damar Hamlin's case, it was actually something that's exceedingly rare called commotio cordis, and it's when you get struck in the chest very hard at the exact wrong time, when your heart rhythm is at a certain point, and it's like lightning striking. It's absolutely rare, but yeah, it can be from a number of things. Inflammation of the heart as a result of a virus can cause it. And then one of the other more common causes is when the coronary arteries come from the wrong place in the heart. And that is one of the more difficult ones, because certain coronary anomalies, we recommend surgery. Other ones, we have to try to determine whether or not they're going to get surgery, and we have to do testing to determine that.
That's so interesting. So, we've gone through this in our household. I'm sure you've gone through it in your household. When kids go to play sports, they have to go through a physical screening, get cleared by the doctor, but cardiac health is not usually one of the checklist items. If parents do have concerns about this, listening to this, what should they be doing?
It's a great question. So it always starts with a conversation with your general pediatrician. The general pediatricians are quite good at screening for these things, looking for family members that might have a history of sudden cardiac arrest, family members with inheritable genetic defects, but that's not always going to be the case, and oftentimes it's silent. You would never know that something was going on until it happens. And so the other thing is a frank conversation, not just with the pediatrician, but with the child, okay, or with the sports participant, adolescent, and having an open conversation about how they're feeling during their sports activities.
And I know one of my daughters was born with a heart murmur, and they always said to us, like, watch her. Does she become overly stressed when she's working out? What's her color like? So parents can really just kind of take visual cues. But I know you guys are doing something called a specialized stress cardiac MRI. You're one of the few locations that are doing this. Can you explain what that is? And do parents need to do this for their kids if they're, competing in sports at a higher level?
Great question. So Children's Hospital Los Angeles about 1 year ago opened one of the most advanced imaging centers in the country. 2 dedicated cardiac MRIs for cardiac disease and evaluation. The stress cardiac MRI program is actually quite specialized, but it is very specific for certain types of cardiac anomalies. One is for those coronary artery anomalies that I was telling you about. And what we do is we try to mimic exercise. Now, it's impossible to truly mimic exercise without exercising, but we try to do it with medicines. And those medicines will put a stress on the heart, and we can watch the perfusion of the heart in the MRI scanner on those medicines. And there are different types of medicines we can use to try to mimic different stressors. And so looking at the heart perfusion is something that is going to help us figure out who needs surgery and who doesn't.
Christine just brought up that obviously in your daughter's case, you have physical cues you can watch. If these are silent types of things a lot of the time, what should parents be looking out for?
Great question. So looking for kids who maybe seem like they're not really reaching their peak anymore. When they're high-end athletes, or even just doing regular sports, soccer with AYSO, things like that, and all of a sudden they say, you know what, I can't quite keep up with the other kids anymore. Chest pain is a big one. Chest pain during activity, passing out during activities, feeling dizzy during activities, or feeling your heart racing during activities, and heart racing in a way that makes you have to stop. And kids will actually come up to you and say something just doesn't feel right.
So listen to them.
So listen to them and have open conversations about how they're feeling during their sports participation.
All right, Dr. Detterich, thank you so much for being with us. This is great conversation. I feel like parents will be paying attention to.
Yeah, and we're so lucky to have CHLA right in our backyard.
Absolutely.
Thank you.